Fragile and frightened, on camp beds placed 1 metre apart, tents and shelters are now being used as hospital wards in northern Italy. Some patients have emergency space blankets placed over them to help with chills. The stream of sick people is constant. Some come via ambulance, others walk in and are guided to a checkpoint for tests. Equipment is running out and the staff haven't rested in weeks.
The main problem is a patient coming in afraid. They find themselves in a tent and not a traditional hospital building, which doesn't reassure them. If they're diagnosed with the virus, we have to calm them down and explain what will happen.
As Italy tracks its losses, with more than 1,200 now dead, the rest of Europe watches on in horror, wondering how many weeks or days before their countries look like this too. Outside the makeshift hospital ward, amid the fear, a homemade banner proclaims, "It will be okay." The World Health Organization says the trajectory of this virus in each country depends on how it's reacting. In Spain, a state of emergency has been declared for the next 15 days. Police locked down over 70,000 people in towns close to Barcelona. While in the south of the country, emergency vehicles were on the roads, announcing people should stay at home because stopping coronavirus is everyone's responsibility. Britain is an outlier, currently choosing not to take the extreme lockdown measures seen elsewhere on the continent. Europe may currently be the epicentre, but leaders in the Americas have been exposed too. Canadian Prime Minister Justin Trudeau is in self-isolation after his wife tested positive following a visit to London. He held a press conference keeping a safe distance from reporters.
I am in isolation, as are my children, and my wife is in quarantine.
Canada's parliament has also been suspended.
Eu estou com 64 anos, se der por acaso daqui a pouco o teste de positivo, né?
Se der positivo, o presidente vai ter que despachar daqui, a gente vai recomendar o isolamento domiciliar.
Brazil's President Bolsonaro appeared in this Facebook broadcast with the country's health minister to reassure Brazilians after being tested himself. There are now reports it was positive, but he has denied them, claiming his results were negative and that people shouldn't believe the fake news media. Bolsonaro's communications secretary, seen here on the right, does have coronavirus, and another world leader has been potentially infected by him. On Saturday, he posed with President Trump.
President of Brazil, you've done a fantastic job.
And while the White House says the pair had almost no interactions, the photos and video on his Instagram suggest otherwise. Mr. Trump was also filmed shaking hands with Mr. Bolsonaro. Countries around the world are now imposing extreme measures. After the Philippines announced a local travel ban will come into force this Sunday, there was a scramble to get out of Manila. Even with a nationwide lockdown in place, Italy still struggles. Today there was a 25% spike in the death toll, the largest rise yet. Amid the agony, Italians try to keep their spirits up. Videos of neighbours singing the same song from inside their homes are now going viral. Italy has taken aggressive measures. Will Britain follow suit or remain reluctant?
Well, stock markets have rebounded slightly today after London and New York experienced their biggest one-day decline since 1987 yesterday. Central banks have announced measures to ease pressures on businesses, but many are still warning of the dire impact of the coronavirus. Our business and global trade correspondent Paul McNamara joins me now. Paul, how bad is it?
Well, let's start at least with the glimmer of good news. Today was a slightly better day than it was yesterday. Part of that is because yesterday was so bad, like the last worst in 30-odd years, there's going to be a little bit of a rebound. So the Dow Jones today, a short while ago, that was up 3.5%. Part of the rebound was also because investors started hearing the things that they want to hear. So the German finance minister, for example, he said, we will offer unlimited credit to struggling firms. They're talking about £500 billion worth of government loans that they're going to give out. The EU have said similar. But the EU's chief economist then went on to say, across the Eurozone, he expects to see zero growth or negative growth. Negative growth, to you and me, that's a recession. So look, across the EU, stocks were up at about 1%. Here, the FTSE closed up 2.5%. Don't get too happy about that 2.5% though. Look at this. So we're about to see, this is how the FTSE's been doing for the last while, all going great guns, and then that's about a month ago. In that month, that drop, that there is 30% of the value of the FTSE being wiped off. That's huge.
That sounds very alarming. What does it actually mean to people?
Well, yeah, you might regret asking that, actually. So if you're sitting at home right now and you've got a pension, right now it's worth a heck of a lot less than it was a month ago. But look, pensions in the long run, they will go up again. More worrying, we are now looking at a case of job losses. Lots of them, and at big firms, not just at small places that aren't able to weather the storm. It's a point in case, British Airways. Today, their chief executive messaged staff, and the language is about as strong as it gets from a chief executive. Alex Cruz said, "To be frank, given the changing circumstances, we can no longer sustain our current level of employment and jobs will be lost, perhaps for a short period, perhaps longer term. We are suspending routes and will be parking aircraft in a way we have never had to before. Please do not underestimate the seriousness of this for our company." At one point he was saying it was worse than 9/11. And it's not just them. Edinburgh Airport today said they're preparing for a scenario where they could be no flights for 3 months. 7,000 people work there.
And what about other areas of the economy?
Well, yesterday I spoke to one analyst, and he said, we're now at the point of no return. So the economy has slowed down so much that even if coronavirus went away tomorrow, damage has already been done and jobs will be lost. Have a look at this. This is from a firm called Wireless Social. They use a lot of fancy technology to measure footfall of people going in and out of bars, pubs, clubs, restaurants. And this is year-on-year change. So at the start there, down 6%. That is 3 weeks ago, 6% decline of people going into bars, pubs, clubs, restaurants. That figure there is last night. That is down 20%. What does that mean? I spoke to one analyst who said, this is unsustainable. The only surprise he's seen is that we haven't had actual closures or job losses yet.
Paul, thanks very much for joining us, I think.
Yeah.
Apologies.
Not sure thanks is the right word.
Kathy.
Well, earlier the WHO raised the temperature. This is what they said today.
Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China. More cases are now being reported every day than were reported in China at the highest of its epidemic.
Well, a short while ago, I spoke to Dr. Bruce Aylward, Assistant Director at the World Health Organization, and I began by asking him if he was concerned that the UK government appeared to be holding back from containing the coronavirus now that Europe is the epicenter of the outbreak.
Well, I don't know all of the specifics of what's being done in the United Kingdom, but what I can talk about is what does work. And you know, the experience I have comes mainly from China and a few other countries that I've worked with over the last while. And their success in minimizing the amount of damage that this disease caused was, whether economic or in terms of lives, was through broad testing. And when I say broad, I mean anyone who was a suspected case got tested in these countries. They rapidly identified who was a case. They tried to effectively isolate those cases, whether in a hospital most frequently, and then to quarantine their closest contacts. And that was the way that they slowed this down in China. And people often point to China and say, look, they managed to slow this down. I think what we've got to be very careful of is that we don't cherry pick bits and pieces of what China did, but really apply the rigor that they did in many different provinces to control this thing.
Is it therefore surprising that the UK is not going to be testing people in their own homes anymore who have suspected cases? They're only going to test people who end up in hospital. What do you make of that?
Well, here I think we've got to be a little bit careful because we know what worked in one place in China. We know that Korea are doing a lot of testing and they're bringing the numbers down because they can find the disease. But I think we've got to be very careful when we say we know exactly what works and what doesn't. You've got some very clever people making the decisions around how to run the UK program. And I think what the important thing is we move forward with a policy. We try it, and if it's not working, we'd be ready to adapt, adjust, as needed to try and bring down the intensity of transmission. So there's no right or wrong right now with the disease that we've known for only 12 weeks. The key thing is to throw everything you can at slowing it down because we know that this can cause tremendous damage.
So can you understand why the government isn't advising cancelling sporting events, and actually those organisations have sort of taken matters into their own hands?
I anticipate what they're doing is looking at their transmission characteristics, the nature of the cases, how they're clustering, which I haven't seen the specifics of, and they're saying we don't believe those would be major drivers of it. So they're trying to make an evidence-based decision on what drives the transmission in a place like the UK and base their policy on that.
That is quite a gamble, though, isn't it? And I mean, people can't escape the idea that perhaps we're kind of human guinea pigs in all of this because we know so little about how to combat this virus.
We're all guinea pigs, Kathy, unfortunately, because it is a new virus. And to say that anyone knows exactly how to do this would be hubris at this point.
You've placed a lot of emphasis on the importance of testing and how other countries have managed to slow the spread through lots of tests. We're reporting tonight on a new rapid testing kit, which will be available in about a week, which will produce test results in 10 minutes. How much of a breakthrough do you think that kind of testing will offer here?
Oh, that'd be fantastic. It's a test that tells them whether or not they've been infected in particular, or they're currently infected. Then remember, that's going to make it so much easier for people to know I'm a risk or not, and to take that much more seriously the fact that they have to isolate. Because when we're working in China, for example, and in other countries, sometimes testing just fell way behind the caseload because the cases got ahead of the PCR testing. So if they've cracked the nut on that could facilitate the whole response. Anything that cuts hours, cuts minutes, cuts days out of the time taken for someone who is feeling unwell to know whether or not they have the disease is a huge gain in terms of taking the heat out of this outbreak, slowing it down and saving lives.
A lot of people in this country have seen the pictures coming out of Italian hospitals. They're now seeing Spain declare a state of emergency. Can the UK avoid the fate of Italy and Spain, or really are we bracing for a really very serious public health crisis here, as the Prime Minister said yesterday?
Well, what I always like to go back to, and I sound a little like a broken record, but is the experience that I saw in China, where they had a couple of, one province in particular out of 31 that was hit horribly by this disease. But the other provinces then realized, okay, if we can rapidly identify who may be unwell by their symptoms, the test ideally, but also by symptoms, if you can get those people to isolate and break down the transmission of this thing, then you will take the heat out of it, and you will not necessarily see the fate of some of the big places where this is really blown up. And I think the other thing we have to remember, Kathy, is we don't fully understand this virus. Why does it blow up in some places very quickly like it has and not in others? There's lots of speculation, but the reality is this is a biologic process, and embers fly off this particular fire into different places, and sometimes they blow up fast, sometimes they smolder and blow up. We're still learning that part, so it's never inevitable. The key thing is to move fast to try and identify where that virus is, and then make sure that those people isolate themselves.
Are you concerned that as China starts up again, just 8 new cases today, but as its economy starts up again, people start getting back to normal, that there will be a resurgence of this outbreak there?
Yeah, it's not that I'm concerned, Kathy. It's the whole government of China, the people of China are concerned about this. And as a result, they've been very careful in preparing for the restart of bolstering of their economy, getting their society moving, getting their business moving, getting their schools going full board again. What they were doing to prepare for that, they said, we're buying ventilators and we're building isolation beds because we think there could be a resurgence. The virus is still around. It hasn't disappeared completely. But we do not have to close our schools, our economy, et cetera, a second time. We want to build the capacity to manage this disease if we have to while we live with it. So China is taking it very, very seriously. They are not hoping it's disappeared for good. They're preparing to continue to do battle with this virus if they have to.
I mean, you talked about how China is preparing for a potential resurgence in terms of ventilators. We've surveyed 1,000 NHS staff for our programme tonight. 99% say that they don't feel that the NHS is in a good position to face rapidly increasing numbers. Are they right to be concerned?
The world is not ready. This is not about the UK. This is not about the NHS. This is about the world isn't ready for this disease. We have not got the ventilators necessarily. We have not got the beds. And that's the reason we have got to find the virus, try and take the heat out of it so that we don't have to use every single bed and every single ventilator that we have.
Bruce Aylward, thanks very much.
Well, let's have a quick update on which countries have today announced that they are curtailing people's movements. The Netherlands, Czech Republic, Slovakia, Malta, Ukraine, Turkey, Pakistan and Hong Kong have announced travel restrictions and quarantine measures. And at least 4 South American countries have, just like in the US, now banned flights from Europe.
Well, in Iran, the authorities have warned people they have 24 hours to get off the streets or the army will force them home. Roads, shops and communal areas are to be emptied as the nation's death toll continues to soar. And the Iranian regime finally shows signs of acknowledging the seriousness of the outbreak. And as our international editor, Lindsay Hilson, reports, doctors have been trying to raise the alarm there for weeks.
In Tehran, they're preparing for Nowruz, Persian New Year, in the traditional way. And only now, more than 3 weeks after coronavirus hit, has the government told people not to travel on holiday, to close shops and get off the streets.
I beg the people to minimise their trips and contacts and to isolate those who are infected.
The last time we saw the Deputy Health Minister was on February the 25th, since which time he appears to have recovered from the coronavirus, unlike many of his compatriots. Earlier this week, the body of a senior doctor was borne away in an ambulance, another victim of coronavirus, mourned by the staff at his hospital in Gilan province. A few days earlier, Dr. Vahid Monsef had been recorded on the phone expressing his desperation.
من چون اینجا چیف رزیدنتم هستم، یعنی هر ساعت وضعیت رو باید باز پیگیری کنم و به این و خبر بدم به اون و خبر بدم. مثلا آمار مرتلیت وحشتناکه. روزی 20 تا خود ما داریم تو بیمارستان. الان هم دیگه سرطان 30 مریض اکسپریمنت فعلا سرطانخونه هم جا نداره. یه وضعیت فاجعه باری هستن. از جنگ هم رد کرده دیگه.
The Beheshte Masume cemetery in Qom has at least 100 fresh graves. The government says another 85 people died overnight countrywide, but many Iranians believe the real number is far higher.
نمیدونیم چی میشن. اصلا نمیفهمیم. مریض میاد. علائمش آنچنانی هم نیست. یه سردرد، یه تنگ نفس هم نداره. یه میالژی مختصر. چی میگیری میبینی دوتاریه درگیر. وحشتناک. دوتاریه سفید تو چستش. چیکار کنیم؟ اصلا اینا چی هن؟ چیکار باید بکنیم؟ هیچی نمیدونیم. بعد یه سری را مجبوریم مرخص کنیم وقتی خیلی درگیری این نمیفهمه بره تو خونه قرنطینه که. اینم میره تو اجتماع 10 نفر دیگر آلوده میکنه.
A well-known Iranian actress filmed her conversation with a friend in hospital. She doesn't seem to be too badly affected, but there's a shortage of respirators to deal with more serious cases. Many Iranians are furious that Mahan Air, a private airline used by the Revolutionary Guard, was flying to and from China even yesterday, according to Flight Radar 24. Another doctor in a different province was recorded venting his fury to the local governor. We've revoiced him in English to disguise his identity.
Why should I have to wake up to find a patient I've been treating for 4 or 5 days is dead? You only hear about it. You don't see their face, but it's right before my eyes. We're tired of all these shortcomings and saving face. The person mustn't find out. It will look bad. And for so-and-so not to be upset, and for so-and-so not to be offended. To save face in front of whatever country.
Next door in the Iraqi city of Basra, volunteers are disinfecting the streets. The WHO says travellers from Iran, mainly pilgrims, brought the virus not just to Iraq, but to 14 other countries too. The Iranian government has woken up late to the damage wreaked by their cover-up and failure to act.
Lindsay Hilson there. The Education Secretary has defended the decision to keep the UK schools and colleges open. The policy is in direct contrast with closures across Europe. Addressing school leaders today, Gavin Williamson insisted it was the best course of action. But was the advice enough to reassure head teachers? Our Home Affairs correspondent Darshna Soni has been finding out.
I just wish that we could be meeting under better circumstances.
And what circumstances they were to be delivering his first speech as Education Secretary to the School Leaders Union.
In the overwhelming majority of situations, there is absolutely no need to close a school or to send pupils or staff home.
Over 1,000 delegates tightly packed into an enclosed space, a type of gathering that may soon be banned. Among those listening, head teacher Diane Anderson and her colleagues, who admitted they had been a little anxious about attending.
I do have to admit it was a little bit concerning, but we've listened to the advice that's been given and tried to take a measured decision about it.
And just lots of hand washing.
Yes, definitely so.
Dominating the conference talk, the government's insistence that schools should stay open.
Do you feel confident in the strategy?
I think this is new for us. This is something that we haven't experienced before. So feeling reassured, no, not at the moment.
I think the issue is when you're hearing that all the other schools are closing in Ireland, all around, what is happening here? You know, what are we going to be doing on
Why aren't we closing here?
Why aren't we closing? And I had a call from a parent, you know, really worried. You know, Miss, aren't you closing the school? I really don't want my child to be catching anything.
The government has denied that it's out of step with other countries in Europe, including Spain, Italy and Ireland, who have decided to shut their schools. It insists that it's following scientific advice. But are there other practical considerations behind the decision? It's telling that in his speech here, the Education Secretary said that sending pupils home would put strain on key workers, including nurses, who would have to stay at home to look after them.
It's a completely different story here in Spain. It's empty classrooms along with Italy, France and Denmark, illustrating the stark difference with the UK's approach. And in Ireland, nurseries, schools and universities have also all been closed. But over the border in Northern Ireland, they remain open, a decision criticised as confusing.
Now is the time to ensure that all schools are closed, that universities and colleges are closed, and that needs to happen immediately. I think the fact that there has been contradictory medical evidence out there is a problem. It's a problem for people whenever they're trying to make the right decisions for them and their families.
In England, despite the government's advice, a growing number of universities have told students not to turn up to lectures next week. Although campuses will remain open, they'll be switching to online learning and exams. At the School Leaders Conference, many felt that the closures will inevitably come. There are concerns about the timing. The exam season starts in May, just before the time scientists predict the virus will peak.
I think what teachers will be doing is reassuring young people that the regulator, Ofqual, working with the exam boards, have got contingency plans for precisely that. And it's not as if this will be the first time that schools have ever had to close during exam season or that students haven't been able to sit a particular paper. That has happened and does happen. It's just not happened on the scale we might be facing.
The government has said it'll keep its decision under constant review, and it's cautioned those calling for closures. Its scientists have advised that if they're to be effective, the closures would have to be at least 13 weeks long. Darshna Soni, Channel 4 News, Birmingham.
Well, Britain's sporting calendar has unfortunately been destroyed by the coronavirus, with the majority of national and international events now cancelled or postponed. Joining me now is our sports reporter, Jordan Jarrett Bryan. Jordan, it's been mayhem today, hasn't it?
It has, yes. And it's only yesterday the Prime Minister and the government announced there'd be no cancellations of sporting events or large gatherings. That position remains the same. Their stances stay the same on that. But just 24 hours later, many of the sporting authorities have gone against government advice, have decided that we're going to take matters into our own hands. Now, just to warn you, I'll be using the word postponed and cancelled a lot in the next couple of minutes. But let's start with the football. In the Premier League, they have announced, alongside all the other major sporting leagues and bodies across the men's and women's game in this country, in England, that they will be postponing all fixtures until the 4th of April. In Scotland, they have also announced no more fixtures. They'll be postponing all football in the top flight of the Scottish League as well. No games until further notice. If we then go to games that will be played in European competitions, UEFA, who are the governors of European football today, announced the postponement of all games across their two competitions, the Champions League and the Europa League. No games will be happening there as well. We mentioned yesterday on the programme that UEFA will be having crisis meetings on Tuesday. I don't know how much of a crisis it can be if it's not till Tuesday, but they're having an emergency meeting on Tuesday to discuss what to do about this summer's European Championships. And we're expecting them to announce on Tuesday they're going to postpone those championships until next summer, until the following summer. So lots happening there within football. If we go back to the Premier League, last night, the news broke that Mikel Arteta, the Arsenal manager, had tested positive for the coronavirus, and we believe and we think that that may have triggered the Premier League into making their announcement today. And the Watford manager, in his press conference, was very critical of the government's stance on what to do regarding sporting events. He was very outspoken about what Boris Johnson was or wasn't doing, and he also mentioned what was happening at his club itself.
The fact that we've had several individuals within the club, and that's staff included, that's not just players, who have had symptoms that are we need to be cautious of.
Well, beyond football, what impact has the virus had on other sports and events?
Well, the most recent postponement today was the London Marathon. That's been now pushed back until October. If we look at rugby, the Six Nations clash between Wales and Scotland, that's now been postponed. Cricket, England's tour of Sri Lanka, cancelled. Golf, the Players' Championship cancelled. Masters, one of the biggest events in the sporting calendar, postponed. And in Formula One, the Bahrain and Vietnam Grand Prix also cancelled. So many events and fixtures across the sporting calendar at best postponed.
So sport basically postponed or cancelled, that
Basically,
just covers
yes.
it. Jordan, thanks. Jackie.
Well, joining me now is Nick DeMarco, a sports lawyer at Blackstone Chambers. Jordan said it all there, really. It's an extraordinary day. The government advice has been to carry on, and yet sport took the decision into their own hands, essentially.
Well, yes, that's right. I mean, in just about every other country in the world that's been affected significantly by COVID-19. You've seen public gatherings and sports events cancelled or postponed. And many, I think, were asking, why hasn't that happened here? And as you say, football's had to take the decision itself. It was probably inevitable because as of today, 7 Premier League clubs have got players either infected or self-isolating. So you cannot have a competition played when that's happening. And then, of course, there are the health risks to spectators. And it's not just being in the stadium, but going there and drinking in the pubs afterwards and so on. So it was probably an inevitable decision.
But interesting that it was taken by the sport themselves.
Absolutely.
And of course, there are enormous economic implications of this, aren't there?
Enormous, because many of the clubs, particularly the lower league clubs, are heavily dependent on match day income. And they will now have to be paying their players' wages, salaries every week, as well as their other outgoings, without getting any match day income. We already saw Bury last year go under. There could be a lot of other clubs. And the authorities will have to ask themselves, what can they do to step in to help them? Do they need to relax financial fair play rules and so on? And then at the top end, if this isn't just a postponement, but it's a cancellation, you could see claims of hundreds of millions of pounds brought by the broadcasters saying that they haven't got the product they paid for. So there are enormous economic implications for football here.
And what about for the fans? Of course, the loss of watching whatever their beloved sport is one thing. But there are other issues, presumably, too, like season ticket holders.
Well, I was going to go to QPR tomorrow with my ticket, and I can't. A lot of people will feel that. But the real issue is what's going to happen after April the 4th? Because at the moment there's a postponement. All the science is suggesting things are going to get worse in 3 weeks' time. So there may be a problem of talking about cancelling the season. Now, if that happens, if you imagine you're a Liverpool fan or a Leeds fan, you've been waiting for this day most of your life, it would be incredible.
Nick DeMarco, thanks very much for talking to us today. Thank you.